Hello, my name is Greta Oldham, and today I am going to be talking about how marijuana helps treat Parkinson's disease. And honestly, just a little bit of a disclaimer for this video. I'm going to try my best to present it to the most energetic part of me as possible. I've had a really rough week, so anyways, yeah, just if I seem a little bit, lifeless, I guess, that's why. But I'm really trying to just put it to the side and just try to focus on this assignment and give you some reasons why medical marijuana, Mary Jane, cannabis, 420, whatever you call it, is proven to help treat Parkinson's disease. So researchers are constantly looking for new therapies that can help people manage Parkinson's disease symptoms and overall quality of life. Marijuana is one possible alternative treatment. Parkinson's has been studied for years, and there's still no exact cure for the disease. There are several treatments. My grandma had it, but she unfortunately passed away. It can be genetic, it can be environmental. That's the way my grandma had it. But marijuana has been a big treatment with great results in reducing symptoms. And what are the benefits for using marijuana, and what are the effects that can help treat symptoms, you may ask? So Parkinson's disease is a brain disorder, just a little background, that leads to shaking, stiffness, and difficulty with walking, balance, and coordination with muscles. Its biggest effect on the body is the stiffness of muscles, and how marijuana is used in patients has shown improvements of muscle relaxation when using the drug. So Parkinson's disease affects 1 in 2 per 10,000 individuals, and its prevalence increases with age, affecting 1% of the population above 60 years of age. It is estimated that the number of individuals with PD is expected to increase to 9 million by 2030 in 15 of the most populous countries worldwide. About 3% to 5% of the world's population is known to use marijuana, making it the most popular intellect substance. My second point in marijuana use is marijuana's use of pros when using it with patients. Medical marijuana has been observed to improve both motor and non-motor symptoms, including bradykinesia, rigidity, tremor, sleep, and pain. Some people with PD have reported a calming effect on their tremor and dyslexia with the use of marijuana, according to a study. A study demonstrated by the effects of cannabis on 85 individuals with PD. Most of them consumed half a teaspoon of cannabis leaves along with their prescribed medication for PD. About 46% of these individuals reported relief of PD symptoms in general, occurring at an average of 1.7 months after the first use of marijuana, suggesting chronic use of marijuana may be required for improvement in symptoms. Why is marijuana beneficial, you may ask? Marijuana consists of 85 cannabinoids, my apologies for butchering that, from which cannabidiol and THC, so CBD and THC are pretty much what they are the main constitutes. CBD and THC are responsible for the medical effects of marijuana. Medicinal effects of marijuana. CBD is a non-psychoactive and is known for hypnotic, anxiolytic, antipsychotic, and neuroprotective effects. THC is the main component responsible for psychotropic effects of cannabis, and it acts via two types of G protein coupled receptors known as cannabinoid type 1, aka CB1, and type 2, which is CB2. CB1 receptors are located mainly in the central nervous system, and CB2 receptors reside in organs and cells of the immune system. The significant presence of the cannabinoid receptors is the basal genialia is the reason behind the significance of cannabis and cannabinoids as possible psychotherapy for treating PD and dyslexic movement disorders. Endocannabinoids are produced in the body and help regulate memory, pleasure, concentration, thinking, movement, sensory, and time perception. They act on CB1 and CB2 receptors. While THC is a psychoactive and partial agnostic to CB1 and CB2, CBD is indirectly agnostic and the cannabinoid receptors and modulates the side effects of THC by increasing the CB1 receptor destiny or some other CB1 mechanism. CBD inhibits the psychotropic effects of THC and improves its tolerability and therapeutic window without being intoxicating. Studies also suggest that cannabinoid agnostics exert anti-Parkinsonian effects, while agnostics help with motor control. And disease benefits from marijuana. THC has shown to improve both active and hand-eye coordination in an animal PD model. A clinical study of 22 patients with PD and smoking marijuana resulted in improvement of motor symptoms and bradykinesia, resting tremor, rigidity, posture, along with non-motor symptoms such as sleep and pain. Obviously, mood, memory, fatigue were other factors that cannabis has a positive effect. About 85% of patients reported effectiveness as moderate or higher due to improvement in symptoms and not worsening with the use of cannabis, which is really good. My bad, let me just charge my computer real quick. Okay. Also, medical marijuana has been proposed to improve sleep, which is important, as demonstrated in a clinical trial of 2,000 patients with various pain disorders. Studies have further suggested that marijuana can help with spasticity and pain in people with PD, and NS has neuroprotective effects of it. So in all, marijuana is a very controversial thing and is still being debated whether or not it should have full access to the medical field, but there are many sources stating improvements of incurable diseases like Parkinson's that have shown benefits and that other medications can't compare to, like sleep and relaxation, because we all know a lot of drugs can really mess us up very easily, and medical marijuana has definitely shown better and, in my opinion, more healthy sides of it. Anyways, it's a lot more natural, and I feel like it can also be not healthier, but definitely a lot more pleasing to your body, in my opinion. And it's not addictive at all. That's one of the best parts I see of it, because we all know pill addiction is very easily manipulated when you're giving surgery or you are dying of some disease, but marijuana is non-addictive. So not only will you have a nice high, but you won't have to spend an extra $10,000 of rehab if you get addicted to oxys or something. In conclusion, there's still lots of ways, a long way to go studies wise, and just the fact that all of the country only sees marijuana as a negative street drug, when in reality it's not just a drug, it's a medicine that has helped many people with incurable diseases like Parkinson's, and it has been used for centuries for different kinds of things, and how marijuana has shown greater effects than most medication. I think one of the best outcomes in using the drug is that it's not addictive, like I've said, which most medication is, which could lead to darker things in patients like addiction. Marijuana shouldn't be looked at down upon for its reputation in the past, but to look at it in a more positive way and see what positive effects it has on patients. And that is my presentation.